Welcome to BW Healthcare World. Today is a National Bone and Joint Day. I have received a lot of questions related to major joint replacements, which is knee and hip replacement. To know why we need a National Bone and Joint Day and to answer questions on knee and hip replacement, we have with us two amazing doctors. Dr. Jatinder Bir Singh Jaggi, who's the Associate Director, Orthopedics and Joint Replacement at the Max Hospital, Gurugram. Joining him is Dr. D.K. Das, who's a Senior Consultant, Orthopedics and Joint Replacement Surgeon. He's also the founder of Cure My Knee. Welcome, Dr. Jaggi. Welcome, Dr. Das. Dr. Das, my first question to you is, why is there a necessity to observe this National Bone and Health Day?
Thank you so much for having me here in this important discussion. And it's an important day for all of us. Reason being, we are celebrating National Bone and Joint Health Day. So let me simplify this in a different way. We have been after COVID and other comorbidities like diabetes, heart problem for decades, we don't know, some thousands of years, right? But bone joint, which is so essential for all of us, reason being the excess of the doctors population versus the orthopedic surgeon. Approximately, we have around 20 to 30,000 orthopedic surgeons, and the ratio between orthopedic surgeon and Indian population is approximately, if I'm not wrong, around 60,000. So 60,000 patients are catered by one orthopedic surgeon. So it's a matter of concern. Like to begin with, we would like to ask Dr. Saab, what are the concerns now we are having at the moment regarding the joint and bone problems? Because we have been neglecting bone and joint. For example, everybody has some kind of injury in their life. Maybe knee injuries, hip injuries, and shoulder injuries. So we normally think, chalo ji garam patti laga lo, move laga lo, thode se 2-4 din rest le lo, theek ho jayega. But practically, if you see, if you have an injury in your knee, there are 6 ligaments and you are hurting some ligaments, and some part of your life, you will definitely face problem. And that problem leads to degenerative changes, what we call wear and tear of the knee. For example, in shoulder, if you have some injuries, so if there is an injury, there could be a ligament injury that can lead to a frozen shoulder. So normally vitamin D deficiency and calcium deficiency, it occurs because of the sedentary lifestyle. And most important is our dependency on mobile phones and laptops. We are not exposed to sun. We are not getting time for doing exercise. We are not maintaining a healthy lifestyle. See, this is not applicable to everybody in terms of if we are living in a urban area. You just imagine persons who are staying in rural areas, tier 2, tier 3 cities. They hardly get time to maintain their health in a way like going to gym and working hard. No. So what they do, they're having irregular food habits, the nutritional deficiencies that also causes the bone and joint problems across.
Got it. So, Dr. Das, I completely agree with you and resonate with you because when I speak to people and specifically the medical fraternity, this is one of the concerns that they brought up for all health conditions, that even in the rural areas, when you look at the farmers who are supposed to be the most active people, their work has been replaced by machines. So that has changed. Their activity has changed, but their food habits, etc., have not changed. So there is definitely a parity in terms of what you're consuming versus what activity you are being involved in. Dr. Jaggi, what are the different kinds of joint replacements that are there that we should know
of? Morning. I'll just try to not get into very technical details of very like medical jargon. I'll try to simplify it so that it becomes easy for everybody to just get an idea of what's being spoken about, right? If you want anything more in detail, let me know.
I have a list of questions that I've received from people, so right. I'll keep asking.
So if you look at it from a joint replacement part of time, There are essentially two types of joint replacements. Essentially two types. One is a partial joint replacement. One is a full joint replacement. These are the two basic concepts. This works more in terms of a ball and socket joint like shoulder and knee, shoulder and hip actually. In knee also, we can do a partial knee replacement and a full knee replacement. That is one type. The second classification we do is whether we use a cement on it. Those are cemented implants. And then we have got uncemented implants. Now, the third classification which can come in is that like with any phones we can have like a base model, pro model. So these joints also come with different bearings. Now, these bearings are the ones which work. It can be a regular metal bearing. It could be a ceramic bearing. So depending on it, the longevity of that implant would differ. So broadly speaking, it's partial or complete, cemented, uncemented. So these are the, like a broad, I put it into a box. Now we can classify it like crazy after this.
Got it. Got it. Dr. Das, what are the causes of joint and bone pain that typically people get? And also, also when you are telling us about this, just let us know, because does it only come by age, or what are the things that could cause a pain in the bones?
I don't know how to simplify it, but let me try. As Dr. Jaggi rightly said, so we should simplify this thing. And every orthopedic surgeon or doctors are not viewing this thing. So let me simplify it. If we ask about bones and joints, so if we categorize according to age, there are certain congenital deformities or congenital problem which can cause, like the age of below the age of 20, below the age of 12. So a child can have pain like vitamin D deficiency or calcium deficiency, like we call it rickets, or any congenital deformity. After the age of 10 to 30, you can say the young age, it's normally these are ligament injuries. I'm talking about the knee, hip, and as well as shoulder. So what happens, any injury, gym injury, or any high energy trauma injury, that can lead to pain, as well as the vitamin D and calcium added as it applies. More than 30 and 30 age, that is 30 to 50 or 60 age, then the degenerative changes starts. The after effects of those injuries which occurred in the past, like for example, some gym injuries, all that. And more than 60 years, you can say mostly vitamin D deficiency, calcium deficiency, lack of exercises, obesity, and nutritional deficiency as well. That causes, and of course the past history of any trauma or injury can lead to the bone and joint pain.
Dr. Jaggi, I mean, one of the very common things that I've seen among young people is when they start getting pain in their elbows, etc., and specifically when people are playing sports like golf and tennis and these kind of things. Can you explain what actually happens?
Right. See, think of your body as a machine. It's as I'll drop it onto physics. So whenever we have moving parts in a machine, we'll have some attrition, some friction happening. Now, what happens is with the modern lifestyle, we're using certain parts of the body more than the other. If you're on the computer, in the laptop, you're sitting sedentary, but your fingers are moving, elbow is coming into play. Then we go and start playing and we suddenly start hitting shots. So what happens is the expectations from our joints are getting higher, but the muscles are not being toned or kept into the optimal positions. So there's an imbalance in the muscle forces which are happening. And what this causes microtrauma. We call it microtrauma, where certain areas, it's almost like keeping a car standing. You suddenly switch it on and then want to floor the pedal. So what that does is, before that engine gets lubricated, the oil gets going, and so there'll be more wear and tear of small things happening. So these sort of injuries what are saying, they are essentially called RSIs, or repetitive stress injuries, where you repeat a stress on a point and that stress is repetitive. You do a certain action again and again, and that's why these sort of pains are more common in areas like around the elbows, where it's called tennis elbow, golfer's elbow. It's around the thumb, where people, like PS4 and Xbox. You get them around the thumbs. So, these sort of things are called RSIs. And they are coming, I think this is the boon or the bane of the new millennia or the modern lifestyle.
Got it. Got it. And can you also share a little bit about what is osteoporosis? Because I see that, extremely common these days in the, people who are working in offices, etc. And it was sometimes, also we could relate to that, umar ke saath ye problems aati hain, but today we are finding it in younger people. So can you explain what is osteoporosis, and what is it that causes this, and how can someone prevent this?
Yeah. Osteoporosis, by definition, there is a test called as DEXA scan or bone mineral density. Once we go on it below minus 2.5, there's a scale. It is defined as osteoporosis. Between minus 1.5 and minus 2.5, it is osteopenia. And below minus 1.5 is normal. So it is age matched, sex matched scoring. Now, what rightly said, we are seeing a younger age group coming through. There are a couple of reasons behind it. One is the dietary habits or our lifestyles. The second thing is now, especially smoking. Smoking is increasing. It's not good for our bodies. It's not good for bones. Second thing is adulterated food. A lot of the times we are taking in food which without knowing it could have adulterants to it, or we are not having a balanced diet. That the food we are eating is more calorie rich than nutritionally rich. So there's a difference. The food is rich, but it's rich in calories, not in nutrients. There's a mismatch there. The next thing that is going wrong is, see, bone also is an organ in a way. It's an organ. It responds to stress. So we are becoming more sedentary. So what the body thinks is, right, we are not using these bones anymore. Let me take out some calcium from it. So that's why that thing is there, that you should keep exercising. It's not that you start hitting the gym or like aggressive exercises, but something like stretches, yoga, which keeps putting some stress on your bones. And that stress response is that the bones get stronger. So by not using your bones, you're not helping them actually.
So how can someone, so you feel that the prevention is basically by exercising and keeping your bones active, so being active
and maintaining a good diet.
Got it. So Dr. Das, let me come to you. How can we detect early signs of knee and joint damage? And when do we know that, knee replacement is the only option, medicines won't work, and nothing can be done? The only option left for you is to go in for a knee replacement.
Okay, rightly said. So if somebody is thinking that I had some kind of pain and having some kind of pain, what will happen in my future? For example, if my age is around 40, so I am having knee pain, then I start thinking, shall I visit the doctor first? Secondly, shall I start some calcium supplementation? Third thing, I should keep going to gym and do some exercises, right? So these are the confusions normally a person has. So after the age of 20, 30, that goes on. So if I categorize in a different way, for example, so you asked me, how do I know that my knee is damaged, right? So if there is pain during movement, pain during climbing stairs, it is affecting my day-to-day activity. See, the reasons for knee pain, normally knee pain, why we consider knee pain? Because knee is a weight-bearing joint. So weight-bearing joint, if it is causing pain, that means it is affecting my day-to-day activity. So how it goes, if the pain is associated with some sound, from cracking sound, popping sound, if the pain is associated with stiffness and it is affecting my day-to-day activity, then I should visit a doctor. If the doctor says we should go for an X-ray and it shows the reduction of the gap between the two bones, the femur and the tibia, the shin bone and the thigh bone, so that means there is some problem with the cartilage loss. And if my age is young and I had some past history of injury, so there could be a ligament injury. So I should try to find out exactly what is the reason for the ligament injury. That means we can go for an MRI that tells about the ligament, because the ligament normally gives the stability to the knee. And if the ligaments are damaged, that leads to osteoarthritis. And osteoarthritis, there are different stages. If the stages, if I'm running into the advanced stage, then I should think about the knee replacement. So if we categorize in three types, for example, clinically or symptomatically, if in a simplified way, if the knee is damaged around 30 to 40%, then we try with medicine, physiotherapy, and lifestyle modification. And if the knee is damaged from 30 to 70% approximately, then we try for intra-articular injections, the synovial fluid, and hyaluronic acid. And if the ligaments are damaged and we think in MRI, it can be repaired or it can be repaired. So we do arthroscopy. So that can relieve the pain and it can delay the process of degeneration. And if the knee is damaged, the cartilage is damaged more than 80%, and it is causing severe pain, then one should think for knee replacement.
Dr. Das, one of the questions that we have received from our audience, and that is quite, several people have asked this, is they want to know in a very simple manner, is this a complicated surgery? And, what are the risks involved in this?
Okay. If I'm not wrong, all orthopedic surgeons are not trained with doing joint replacement surgery, right? So I don't know why. We had in far past history of some bad experiences regarding knee replacement, but now time has changed. And if you ask me in a simple way, how much time it takes? It takes 1 hour, 1.5 hours for knee replacement. Actually, knee replacement looks very big. The reason being the name is big. We are not replacing your bones. We are not replacing any of your body parts, but we are just resurfacing your cartilage. Cartilage means the two surfaces of the joints. So the two surfaces are being replaced. So we call it knee replacement. And about the success rate, and the time has changed, technology has changed, and the expertise have changed. So as we were doing 15 years, 20 years back, now we are doing in a different way. We used to take 2 hours for one knee replacement. Now we take half an hour or 40 minutes for one knee replacement. Previously, we used to use so many like assistants, so many disposables and like that. Now it has become very simple. Reason being, it is being done everywhere and everybody is doing it. So the success rate has increased. And moreover, if it is being done by the surgeon who has been doing regularly and updating himself, the latest techniques and latest trends across the globe, so the result becomes extremely good. The patient can stand after 24 hours. So after 5 days, patient goes home with the help of a walker, and then 15 days, the patient becomes normal. 20 days, he can lead a normal life. He can get back to his office and do a normal life. And there are certain myths about the knee replacement. Like patient asks, doctor, how long it will start? I suppose so many people must have asked you this question. So I think if the joint replacement or the knee replacement is being done perfectly, there is no question of life. I mean, it can last for maybe 40 years, but the book says around 20 years. But if it is normally being done for perfectly, I think it will last forever. There is no harm in doing a knee replacement, thinking that I am very young, my age is young, so I might have to go for another revision surgery. I don't agree with it.
Okay, got it. Dr. Jaggi, let me come to you. I want to know about hip replacement. I know you and I have interacted on this particular topic, and my question to you is, why does the need for a hip replacement arise? Is it only because there is an injury when someone falls, or there could be other reasons associated where there's a need for a hip replacement?
Right. For a hip replacement, two essential reasons. One is trauma, which you said fall. The second thing is what we call as a arthritic hip, like a knee arthritis. We have an arthritic hip, and there's a unique condition associated with hips, which is called a avascular necrosis, where the blood supply to the hip bone or the head of the hip, the head dies off. It's got a unique blood supply, and because of certain reasons, the blood supply goes down. So it's called a hypoxic death or avascular necrosis. And a lot of the times we can't find a reason, but for some reason, like a natural, this is called an idiopathic, that we exactly don't know why it happens, but it blows out. The candle blows off. So the joint becomes rough, and that causes you to be having a painful or an antalgic gait. It basically starts affecting your quality of life. It starts affecting how you walk. Your one leg gets shorter than the other. And that's the reason why we need to go and do a hip replacement for a reason besides trauma. Recently, we have suddenly seen a spike in this hip replacement cases, especially during COVID times. A lot of people took a lot of steroids, massive doses of steroids, and steroids are known to cause avascular necrosis. So at least in my practice, I am suddenly seeing a jump in the amount of hip replacements we are doing. Right now, research is going on, but most of them, I will say that I had COVID, took steroids, and we are seeing them now. So if essentially two things, trauma and avascular necrosis. These are the two ones. The third thing is a congenital part to it. Some people are born with dysplastic hips. That's rare because nowadays we are picking this up very early. So this cohort of patients with congenital disorders is getting less and less, because when our kids are born now, children are born now, things are picked up way earlier and not neglected anymore. Like polio, we hardly see any now. Same with congenital problems. We see them, but not as common as before.
Got it. Dr. Jaggi, when we talk about the injury or the trauma, I've seen a lot of old people who fall and they injure their hips. And so can you tell me, one, until what age is it okay to go in for a hip replacement? And are there set protocols which define that, you can do a hip replacement only until this particular age? And are these protocols in India different from what we have seen in the other parts of the world?
Right. I'm sorry, but in this question, you'll have some very blunt answers coming from me. Very blunt answers. One, if you break your hip, age is no bar. It's a fracture of necessity. We call it a fracture of necessity in orthopedic literature. So the oldest person I have personally operated, me, is 102. 3 weeks ago, I operated on somebody who was 97. So in my book, there is no such thing as age. The risk of anesthesia changes, right? In the West, there is very clear-cut guidelines, extremely clear-cut guidelines. I've been trained in the UK. I stayed in the UK for so many years. Over there, if somebody has got a fracture of the hip, you have to operate on them. If you don't operate, you have to give an explanation why you are not operating actually. And if for any reason, the family says no, and if two medical professionals, there's something called as a Form 4 in UK. The parliament over there has passed a law where a hip fracture by law is mandated to be fixed, because it can be a terminal event in a person's life. So it's not about whether the patient is going to survive or how long the person is going to survive. It's the quality of life. It's dignity in death. If you don't operate a hip, the patient is going to have pain, restricted to the bed, will develop bed sores, will develop urinary problems, urinary infection, chest infections. So the life expectancy, if you don't fix, the patient will not die because of the fracture. It will die of the medical complications that arise because of immobility. Having a 90-year-old in the bed, not able to turn, not able to go to the loo, you can't put them into a wheelchair. Think what is going to happen. So unfortunately, in India, there is no protocol. I've seen, families walk in. Some of them are very aggressive, or aggressive in the sense they say they have to do it. Some of them will say, no, नहीं, मेरे parent है, कुछ नहीं करना है मुझे. अब जैसे भी हैं इनको छोड़ दो. In a way, we are condemning them. So we need to have some law actually in India. We don't, unfortunately. In the West, it is extremely clear. By law, you are actually will be surprised when I tell you this. In UK, the hospital is fined for not operating. There is a financial implication on the hospital if you don't operate and you don't have a valid reason for it.
Got it. But Dr. Jagit, are there any cases where it is not advisable to do a hip replacement surgery?
Yes, there will be very, very special cases for that, where according to a team of doctors, where we do a multidisciplinary meeting, MDT, we do an MDT, where we think that whatever we do is not going to change the outcome of this patient, is very poor from a point of view of the patient is already moribund, is on the bed, on a ventilator or something, like where there is, by doing it also, you're not going to change anything much. And this thing happened because of some sort of a accident, because at that certain age, when people are suddenly turned in bed also, because of osteoporosis, they can break their, especially your shoulders and hips. It's known to happen. So there are very, very, there'll be a very small percent on which you will not operate actually. There'll be very special cases, and that will be taken into consideration when you're thinking this patient has got, it's like the end of life. Like say somebody has got cancer and it's totally spread, and because of the cancer, the hip breaks. And the oncologist has said that, it's just counting days. So at that time, the reason would be, okay, right, let's keep the patient more comfortable. But except these very special indications, there is no reason not to operate.
Got it. So also, has technology advanced in the past few years that has made surgery either easier to perform, less painful for the patient, whether, of course, you're using anesthesia during the surgery, but post-operative pain that is there, or it is less time consuming or with a better outcome? Has surgery changed in the past few years? I'll begin with you, Dr. Jaggi, and then I'll go to Dr. Das as well.
See, there is a sea change. I'll be very frank. When I started training, I'll be very frank. When I started my training, a hip replacement would be like the whole department would start shaking. We are planning a hip replacement. 3-4 days would go into the X-rays, drawings, and sizings. We had limited implants and limited surgical exposure and limited training. Right now, in a well-oiled team, an elderly patient, you can get away with a partial hip replacement in less than 40 minutes, 30 minutes. Like the average time is around 30 minutes to do a surgery, complete. I'm talking about complete surgery. That is tremendous stride because the surgical techniques have improved. The anesthesia is improved. Better training of the surgeons and their support staff is there. We have got better implants. So it's a game changer. It's a game changer. So everything has improved. As regards as pain post-surgery, we have got better techniques where we do local infiltration of anesthesia, LIA techniques we call them. We do nerve blocks where we selectively block some nerves so that less pain is there. And then there are certain sort of pumps which can be put along to the patient, where these pumps will keep on giving a dose of medicine to selectively block that nerve which is causing pain. So the patient has got a better pain relief and is able to mobilize better. So all these things have made this process, I would say, a much more pleasant journey. It's no longer that thing of being extremely long surgeries. To be very frank, I don't remember the last time we gave a blood transfusion to any of our joint replacement patient for a orthopedic reason. So if somebody might need a blood transfusion for some other reason, they came with a hip fracture, but I have got some other for which they need a blood transfusion. But
Right.
for a joint replacement, at one time, if you were doing a joint replacement, 2 or 3 units of blood used to be used.
Right.
So, like I said, it's an absolutely a game changer right now.
Got it. Got it. Dr. Das, has the, what has been the latest development when it comes to knee replacement? I mean, changes in terms of the surgery that you perform or the materials that are used as a replacement?
First of all, I'll add on something to Dr. Jaggi's view. Like, there is no age limit to joint replacement. See, I have done a joint replacement, my knee replacement and hip replacement at the age of a girl of 23 years. And I have done a joint replacement like hip and knee replacement at the age of 97 and 99 years as well. So, मतलब पहले ऐसे होता था कि मेरे नानी, मेरे दादी, चलो जी, as you rightly said, कि कुल्ले की हड्डी टूट गई एंड ऐसी पड़े हुए हैं, चलो जी किस्मत में यही था, अब कितने दिन जीना है, जिंदगी ऐसे कट जाएगी. But now time has changed. Right? Time has changed. At least we, as our parents, we think at least we should visit an orthopedic surgeon. And if the orthopedic surgeon, small surgery, we call it bipolar, that is hemiarthroplasty. I think, I mean, all orthopedic surgeon is capable of doing that. And just imagine a old lady at the age of 80 or 85 and having a fractured neck of femur, bone near the hip joint. So if you do a bipolar hemiarthroplasty, that lady can stand the next day and she will be fine and pain-free till the last day of her life. So very rightly said, as Dr. Jaggi said, it actually matters the quality of life. Now, coming to the question, what are the developments in terms of implants and technology you are asking, right? So as we followed the traditional way of doing hip replacement and knee replacement, giving a bigger incision. Now, previously we used to give 12 inches incision. Now I give it 5 inches. So we are developing our minimum invasive technology, minimum invasive incision. So how it is being benefited to the patient? No blood loss, as Dr. Jaggi rightly said. No pain. So we manage, our anesthesia team, they manage pain very well. So patient doesn't have pain after having a joint replacement surgery. Just imagine the scenario. So next comes the techniques. The techniques have developed because the perfection is coming up. The technology is improving and the approaches are improving. And moreover, the team, the assistants, they are more trained and the timings. So previously we used to do a knee replacement in 2 hours. Now we are doing skin to skin 35-40 minutes. So both the knees are replaced or hips are replaced in around 1.5 hours, 2 hours. So we are not running out of time, but the technology, the expertise, and the system of working has improved. Now coming into the implant. See, implant, it is more, it is evolving according to the patient's needs, and it is evolving. Like previously we used to have steel implant, then comes the titanium implant. Now we are coming to cobalt chrome implant. These are lighter material. These are more body friendly, and the shape of the implant is more according to the normal human anatomy. Now coming to the knee replacement, first we developed different sizes of implant. Then we developed navigation. What is navigation? It's very simple. We take out a CT scan and put it into the computer. The computer tells us how to cut and how much to cut. Now the robotic surgery. What is robotic surgery? If I explain in a simple way for a layman, not for a doctor. So it is very simple. We plan the surgery before going for the surgery. How we do it? We take a CT scan and the 3D reconstruction of the bone is being fed to the computer, and the computer says this much of bone is damaged and this much of bone has to be resected. So this gives an accuracy. The only thing is the robot is actually not very much accessible to every Indian population, because joint replacement surgery is not accessible. So robot, I think it will take years to gather. So, but robotic surgery is good in terms of accuracy, but it takes a little bit longer time. But if the surgeon is very experienced, so I don't think there is much of a difference. But definitely we should adopt robotic surgery, but long way too.
Dr. Jaggi, what is the post-operative care that the patient needs to take? And also, are there any dietary restrictions or requirements that people need to know after any of these surgeries, hip replacement or knee replacement?
Dietary per se, no. The only thing what we say is that don't eat anything that will essentially get you constipated. So from that perspective, yes, slightly careful about the diet, but no special diet per se, one. Second thing, what you said is about precautions and stuff. See, after any joint replacement, what happens is you cut through some tissues, you go in, you put a joint. But every patient is made to stand up the next day. If the surgery is done very early in the morning, then maybe also in the evening. So the patients are out of the bed very quickly. The catheter is taken out if it has been put as soon as possible, because we don't want any urine infection coming through because of the catheter. So the precautions are that you need to be confident, get on with it, and trust your surgeon and the physiotherapist coming along, so that you get away from all these walkers, walking stick, and get on to being independent as soon as possible. With a hip replacement, for an initial couple of weeks especially, we don't allow them to cross their hips. We tell them to put a pillow between their legs. Otherwise, there's no special precautions per se. Especially in diet, there is absolutely no precautions. They can essentially go back to eating what they were like. It's almost going back to life. I joke with my patients, you have changed your hip, not your mouth. You eat what you want to eat. Like a lot of them would ask, nimbu kha sakte hain kya, dahi kha sakte hain kya, khatta, especially. And I would say, like, why not?
Right.
And so, these are some misconceptions, I would say. People will say कि ये बारिश के मौसम है, अभी कराना चाहिए क्या? And I joke with them that I come from UK, and in UK it rains 10 months a year. So effectively they should shut down their hospitals for 10 months. So, these are historical things which happened. And the reason for that rain thing was, at one time, what used to happen was, when you would operate, we used to have these drapes, cotton drapes, which would be washed.
Yeah.
And they would be put out on the sun to dry, actually.
Okay.
Now, what would happen in the rainy season they would not dry.
Correct.
There would be moisture. So the infection rate was higher
during rains.
Now that became a historical part कि वो ना बारिश में जख्म पक जाता है. Now the reason is not surgery. The reason was the drapes.
Got it.
So we don't have those drapes anymore.
Right.
Everything is air conditioned. So things have changed, but क्या होता है, there is something called historical baggage, and it keeps on. You just pass it on, and it's always. I know somebody. A lot of people say, no, who are a lot of these people? I don't know, but these are misconceptions, which I think will only go away with education.
Yeah. So I think, these are myths. I think, platforms like this can actually break these myths. I'm glad you brought this up. Dr. Jaggi and Dr. Das, my next question to both of you is, whoever chooses to go first, we did touch upon that you need to be active to keep your bones fit, but what are the other prevention? I wouldn't even say that prevention, but how does one proactively take care of the bone health?
Do you want me to go, or like? All right.
Yeah.
See, the biggest thing you can do, is keep your weight down.
Okay.
Weight is obesity. We are going to hit a obesity epidemic, I would say, in India. Look at our younger generations. They are all getting plumpier. They are all healthy kids now. Extremely healthy kids. So what is happening is that is causing your tissues to take abnormal stresses. First of all, the biggest thing is diet and lifestyle. That has to be addressed. Healthy lifestyle and a healthy diet. That is extremely important. There cannot be We are right now burning ourselves out. People are working. They have that urge that I need to get working. I need to earn money. They'll work 14 hours a day, 16 hours a day, work from home, sit on the bed, lying down, laptop open, abnormal positions. They're not understanding you are doing it. You're at a younger age. Your body has got that capacity to compensate. See, you buy a new tire and put it in your car. Even if it is malaligned slightly, the new tire has got enough rubber to take care of it. Now, what happens is, as we get older, these bad habits, they will start telling on you. And then there is a price to pay. So people need to understand that, yes, it's good to work. It's good to, do well in life. It's good to be aggressive. It's good to, but it's equally important to look after yourself. That basic principle that if you are not well, how will you take care of others? That concept of that, this is an Indian thing. I need to do it for my family. I need to do it for everybody. I need to, right? You need to, but if you are not well, how will you do it? So that concept of looking after yourself, I'm not saying that you will go crazy and say, all right, I'll stop eating this. I have to stop. You should have your cheat days. You should have your days when you lie in. But overall, maintain a healthy version of you.
Got it.
That is the way forward.
Got it. Dr. Das.
I will add on something. As rightly said, weight is very alarming because very soon, as data says, will be the capital of the world in terms of osteoarthritis. Osteoarthritis is something that is degeneration of the knee joint. One more thing I would like to add on is everybody should keep in mind that one should not neglect any injury. What happens, like if you have any injury, we think, अरे डॉक्टर के पास जाना है, दुनिया भर के टेस्ट कराने हैं, लाइन पे खड़ा होना है, पैसे खर्चा होंगे, चलो छोड़ दो, क्रेप बैंडेज लगाओ, कुछ क्रीम लगा लो, ठीक हो जाएगा. That really affects. I have seen so many patients going to quacks and going to different. I can tell you a story of a chartered accountant, a software engineer, having a fracture in his ankle and going to a massage wala and malish wala for 2 months. After that, he developed a gangrene, and there he had to go for amputation. Even I've seen in my life. So just imagine, this is very common because orthopedicians are not accessible to any. Any tier 2, tier 3, and the urban area there is accessibility, but in rural area it is very difficult to find. First is, one should not avoid trauma. If you wait for 5 days, 7 days, everything is fine, you need not have to visit a doctor. That's fine. But if it is bothering you after months together, you should visit a doctor. Second, weight, as rightly said. Third, regular exercises, because अगर आप, मैं और डॉक्टर साहब, हमने हर बंदे ने धूल मिट्टी से बहुत खेला होगा, राइट? बट आप अपने बच्चों को देखेंगे, कभी धूल मिट्टी और कीचड़ लगते हुए शायद ही देखा नहीं होगा. So everybody, all kids, as rightly said Dr. Jaggi, they have become plumpy. So all this junk food, all aerated drinks, and this new fashion of having this junk food and having good restaurants in malls and ice creams, everything, of course, that is actually killing the childhood of our children, basically. And that is deteriorating. I mean, a child at the age of 15, his weight is 90 kgs. It is very common. Why this is happening? Because the child is not going to field, not playing with any football or anything. No activity, high level activity, only sitting with computers and laptops and iPhones. This is what is happening. That is very important. It is alarming. It is more dangerous than COVID, what I believe nowadays.
Got it. Sir, Dr. Jaggi and Dr. Das, it's been a pleasure to have you with us. But before I let you leave, your closing thoughts. Dr. Das, what is your message that we can take home on the National Bone and Joint Health Day?
My message would be, the only thing is, keep yourself healthy in terms of your mind, soul, and your body. So if you think I'm fine, my bones are fine, my joints are fine, you have to keep it fine. How to keep it fine? Take out at least half an hour from your busy schedule of 24 hours and do something, some activity which is actually increasing blood circulation, giving nutrition to each and every part of your body. And I believe that can keep your bone and joints healthy. And one should have a healthy diet, avoid sugars, fats, and aerated drinks, have healthy vegetables and all green leafy vegetables and fruits as much as you can. I think your joints and bones will be fine.
Dr. Jaggi, before I take your message, I have one question. So people who have a problem with the knee, they are a classic case of knee replacement. But they say that, when they exercise or when they go for a walk or when they go and swim, they feel better. Is this recommended, or should they not be exercising with a injured knee?
See, now this question comes with a caveat actually. Now, if there is an injury which can be addressed, then obviously they should address that injury before they go back to doing anything. Now your question, when you initially said knee replacement, I'm now assuming that this is a patient who's at the age of 60, 65, where the knee is so damaged that it's beyond repair per se. I can't do an arthroscopy and repair a ligament, and so it's beyond repair. Now, if you have a patient like this who has a knee which is beyond repair and is an ideal case for a knee replacement, in my practice, I'm very clear with my patients, please do not sit. Keep moving. Keep your mobility in, because at that age, they don't only have arthritis. Sir, they don't only have arthritis. They'll have diabetes, they'll have heart problems. Their cardiologist, diabetologist will be saying, please walk. If they don't walk, they will have the sugar shooting. They'll create other issues actually. Now, if you need to take a painkiller and walk. For two reasons. You will keep the other things in place, one. Second thing is you'll keep your weight down. Otherwise, you see these patients, they'll have a very classical look to them. Their top part of the body will be a heavier part. Their legs will be thin. That happens to them. The last thing that happens is, if you don't walk, what will happen is your knee is not getting better. Your muscles are getting weaker. So if you keep a car, now I explain it to my patients, I give them an example. Like you think of yourself as a car. Your knees are your tires. Now the car is fine. The engine is fine. The battery is fine. You just don't drive it because the tires are bad. That is what you're saying. Don't exercise, don't walk, don't do anything. Right? What will happen? You make the car stand. Maybe the battery is going to drain off. Maybe standing, the tires are going, the engine is going to get, oil is going to sludge in. Now, one day you change the tires, or one day you change the knees. Now, the attrition which has happened, would you want to change a tire in a running car or in a stationary car? Or stationary means a car which has been kept in...
Not being used.
So, yes. The very simple explanation is you need to keep... Mobility is life, sir.
Got it.
If you have to sit and live the rest of your life, I know some people might do it, but what's the fun of it?
Got it.
If you have to be sitting on a chair the rest of your life and saying कि अब हिलोगे तो knee खराब हो जाएगा और इसी chair पे आप बैठे रहो, that is no quality of life.
Got it.
So mobility and quality of life are interlinked.
Right.
Independence. See, again, the second thing is we are running into a generation which you will also accept. I think ours is the last generation which looked after our parents. Our children most probably will not look after us. So keeping that independence, being able to get up and do your own work is extremely important, where you're not dependent of, like our dadis, nanis, they used to be on the bed, Are beta chai la de, and you would keep running. Nowadays, you hardly have people to... so from that perspective, we all need to age gracefully, age independently, with our own self-respect in our hands, so that we are able to do our own things rather than looking out for somebody to say, in Gurgaon, like there's Ambience Mall. I'm not joking. I love to watch people actually.
Mm-hmm.
You go there on a Saturday evening, and when you enter Ambience Mall, there's benches over there. You'll see all these elderly people sitting there.
Right.
You know what has happened? They've come with the family and the grandchildren, and then they say, "Ab mere se nahi chala jayega. मैं यहाँ बैठता हूँ, आप you go, and मैं 1 घंटे बाद." Think about it. it's a sad situation. I won't call it a sad situation if it can be helped.
Right.
Just because your knees are not working, you're sitting there, and then the family will come back in the evening, and then, it's not right.
Got it. Got it. So, Dr. Jaggi, what would be your message on this special day?
See, for me, this special day, I would say it should reaffirm to everybody that we need to take care of ourselves. We owe it to ourselves, I would say. In addition to, looking after your joints, and we just need to start, I'll not call it self-centric, but we should start loving ourselves a bit more.
Got it.
To say, I need to take care of myself. Looking after oneself should be a priority, which culturally, which I've said earlier also, culturally we are trained, or we are socially, culturally, we are told that we have to look after everybody.
Got it.
That selfless looking after everybody, and that gets drilled into us. Ki, Mera naal kuch nahi hoya, it's fine, but I need to do it for.
Got it.
That thing that we need to look after ourselves as a complete person, it's a holistic thing.
Mm-hmm.
And then this holistic thing, bones are equally important as a heart. If you look at it, there is a lot of thing going about look after heart, stroke awareness. So, but you see, we are a complete body.
Got it.
So what happens is, one department gets hyper, government they'll celebrate. We have to start celebrating that you as a human being should be, if you can't see, eyes mein kuch issue aa raha hai, it's equally important. So one organ is more important than the other. It's the symphony. We can't just blow one's trumpet to say ki bones bacha lo or heart ko jane do, ya heart ko bacha lo or brain ko jane do. So we have to look after ourselves. But yes, my message is that bones are equally important. We sometimes take the lower key, I would say. We are the understated people, because maybe cardiology, stroke, brain, heart they are the superstars, because our conditions are not life-threatening. So when they're not life-threatening, they're underplayed. But you're not life-threatening, but it matters a huge to the quality of life.
Right. No, I think that's a brilliant message. I mean, when I listen to you and Dr. Das, my biggest takeaway is that, I think it's important to love yourself, understand that every part of your body is equally important. It may not be life-threatening, but it will create situations which could be life-threatening.
Absolutely. Yes.
And like you said, that mobility and lifestyle are interlinked, and it is your responsibility to ensure that you're not dependent on anyone because of the lack of care that you had in your life. So with that, I thank Dr. Jaggi and Dr. Das. Thank you so much for taking out time to be with us today to answer these questions which we had received from our audience. I'm so convinced that this is going to be super useful to people who watch this video. Thank you so much for your time once again.
Thank you.
Thank you so much for
having us.
Thank you, sir.
Thank you.